The next pain syndrome that I want to touch on, it is one of the single worst pains that a human can experience, and it sometimes results in suicide attempts because it hurts so darn bad. Howdy everyone, Aaron Boster here, and thanks for learning about MS with me. When I attended medical school, I was taught that MS didn't cause pain. Quite literally, my professor taught me that. And my professor was wrong. Yes, MS causes pain. And it can be very, very frustrating, not just because you hurt, but because other people can't see it and other people may not understand. The next pain syndrome that I want to touch on, it is one of the single worst pains that a human can experience. And it sometimes results in suicide attempts because it hurts so darn bad. And that syndrome is trigeminal neuralgia. If you look at the word, the first word is trigeminal. So the trigeminal nerve comes off the brain and it kind of spreads out and it controls the sensation of the face. There's a portion up here that's called the first branch. There's a portion of the trigeminal nerve here, that's the second branch. And there's a portion down here and that's the third branch. So you have sort of a nerve that is like this. And if that nerve is inappropriately stimulated, neuralgia means nerve pain, then you have a pain in that area of your face. So some people will only have it here, or they'll only have it here, or only have it here, or sometimes they have the whole thing. And it has been described to me as some of the worst pain a human can experience. They will literally do anything possible to get that to not hurt. Now the problem is, if it's down here, as you move your jaw, it hurts. And so I have patients that can't brush their teeth, they can't eat, they can't even risk opening their mouths. They hurt so darn bad. This is a horrible, debilitating pain. It sends people to the emergency department. And as I mentioned, there's even been cases of suicide attempts because it hurts so bad.
When my trigeminal neuralgia acts up, I want to rip my face off. I get trigeminal neuralgia, so painful it's brought me to my knees. I have trigeminal neuralgia on both sides. Is that common in MS?
Fortunately, it is treatable. And the way that you treat it is by using, again, seizure medicines to quell the inflammation. I'll tell you a quick anecdote about a patient who I absolutely adore. He is fantastic. His wife is fantastic. And he had trigeminal neuralgia. And he had it in the past. He had a bunch of medicine at home. And he called me in a panic because it hurt so bad. And I said, look, either we can go to the emergency department. And he said, I can't get to the emergency department. And I said, well, I can treat you at home with pills, but it's going to make you really goofy and sleepy because we're going to have to take a lot of medicine really quickly. And he said, I don't care. So I gave him instructions to take several different anti-seizure medicines all at once at a high dose. And I talked to him later in that day, or maybe it was the next morning, I can't remember. And he was slurring his speech and he's,
oh my God, doc, what did you do to me? I'm on the ground, I'm crawling around, I can't get up, I'm so dizzy and I'm groggy and I'm slurring my speech.
And I said, what about your face? He said,
oh, my face doesn't hurt at all.
And unfortunately, he experienced the side effects of all these medicines in exchange for removing the pain in his face. So I felt bad that I made the guy so groggy and sleepy, but I was happy that we got the pain to go away. So trigeminal neuralgia is unfortunately not all that uncommon in the setting of MS. And fortunately, we're able to treat it. When medicines don't work, there are several surgical procedures like gamma knife, which have been shown to be helpful in MS. It doesn't always work as well as it does in non-MS, but it can work. And the reason is that in MS, it's not as often that the nerve is damaged, but it's the nucleus in the brain. It's the part of the brain that runs the nerve that's been affected by MS. And it can cause a horrible pain called trigeminal neuralgia. Today's topic was pain in MS because MS hurts. And a long time ago when I was in medical school and they told me MS didn't cause pain, they were wrong. Thank you so much for listening in. If you have not subscribed to the channel, please consider doing so. And if you're a subscriber, ring the notifications bell so that when I jump online to do a live stream, it alerts you and lets you know. So until my next time on the internet, my name is Aaron Boster, and I want to thank you so much for learning about MS with me. Take care and have an awesome weekend.